We are back here at Renovus Medical Day Spa, and you know, normally we're talking about a woman's physical appearance. Today we're talking about what's going on inside her body. We're here now with Pam Davis, and Pam, thanks so much for having us out today.
You're welcome. Glad to have you.
Well, we're talking a little bit about hormones and really trying to balance. At what age are you starting to see women coming in with some of these issues?
About in the mid-30s, you're starting to see a change in progesterone dropping off in women. And then as we go through perimenopausal, we start to have some emotional changes, our mental changes as far as we start to get some racing thoughts maybe before we're sleeping. We might have a little brain fog, forgetting just simple little things. We're running errands and forget some things. We also are starting to have menstrual cycle changes, and then as we move into menopause, those things start to increase a little bit more and more and more. And so you start to see women really feel like, what's happened to myself? I've lost myself. I don't feel the same that I did. I don't feel the same mentally. I don't feel the same physically. And they really start to have some issues. And so we have them come in and we start to talk to them about what are the issues you're having. We have symptom checklists we go through. We talk about doing bioidentical hormones, the natural hormones. We don't like synthetic drugs. We know that the synthetics have not worked well. We also know that it is linked to cancer. And so we do know the bioidentical hormones are not linked to cancer. It is a natural substance. We put back exactly what was put into your body, what your body originally created, the way God made it. We're made of chemical and molecular structures. All the cells have organs in the skin, and all these things work on a molecular chemical structure. So if you put the same thing back, the body knows exactly what to do, and the goal is to keep women balanced.
And one of the things that you do is sort of a workup of our bodies, and you do that through a saliva test.
We do. We like saliva testing. We do feel it gives us a better picture of what's going on in a woman's body. And I bring it down to very simple language. When you look at the bloodstream, it's like the FedEx truck with all the packages, and it's driving through the body, but it hasn't delivered those. There are proteins and different carrier proteins that work in the body to take certain structures into the cells. So we know that once it's delivered, the hormones are delivered into the cell, that as we bring it out of the cell with saliva testing, we're seeing our bioactive hormone. We know exactly what is working, not what is traveling through the body, but what's actually working. And then we work on that to get women balanced, depending on what their test results show, and then it's tailor-made for each individual woman. And that's the other nice thing about bioidenticals, is every woman's different, and their symptoms are different.
And you said, too, a lot of times you get a lot of success with creams or maybe something like an oral pill.
Yes, depending on the symptoms, sometimes we will do, most of the time they will start at least with a topical cream that they apply every day. They do rotate their site so that you don't have too many hormone receptors in one area, and you get the best results from that. If we have women who are not sleeping well, they go to bed, their mind will not turn off, then we're going to look at maybe adding a progesterone capsule just to help improve their quality of sleep.
And the good news is there is help. They don't need to suffer through this irritability and this anxiousness.
Yes, we've all seen the woman who all of a sudden was very peaceful and calm, and now they're a little more anxious, they're irritated. And what happens is a lot of times is we're told, oh, we're depressed, or we need an anti-anxiety pill. Well, it's not really that. That's going to mask our symptoms, but it's not getting at the root cause.
And we can do that here at Renovus Medical Day Spa. Pam, thank you so much for your time today.
Thank you for having us.
Hey, for more information, you can always stop by their office right here on the Bristol Highway. It is Renovus Medical Day Spa.